When it comes to seeking medical advice, young Americans are relying on an alternative source.
That's right. A Healthline survey found that 1 in 3 Gen Zers use TikTok as their primary health information source. However, 1 in 11 experienced health complications after following health advice they got from TikTok. And now some people want social media platforms and influencers held accountable for disseminating health misinformation.
Not all hope is lost. While 56% of Gen Z users turn to TikTok and health and wellness advice, more than 60% admitted they only trust health TikToks if they come from a professional. Joining us now is Dr. Mirhom. He's an assistant professor of psychiatry at Columbia University Medical Center. Doctor, thanks so much for being on today. So the appeal of getting information quickly isn't hard to wrap our heads around, right? It's much easier to fire up TikTok than it is to set up an appointment with your PCP if you have one. But is there something shifting our perception of healthcare that's prompting younger people to just hop online for their medical questions?
Yeah, absolutely. Thank you for having me. And that's a great point there. That's actually the reason I got on TikTok myself, is I realized from hearing from patients over the years is that one part is an access question of saying, you know what, I want to be able to jump on and figure out what's going on with me. And then two is even community, realizing that I'm not the only one experiencing this symptom or this question about my health. So there's a lot there that is a good reason for folks to be able to get on. But the big question for us is how we can help patients navigate this information. Because as you mentioned, going on TikTok is sort of like getting health information from just someone off the street. If someone walked up to you and gave you health advice, I would think we'd be a little cautious about it.
Dr., 1 in 3 Gen Zers are using TikTok for their main source of health knowledge. This is according to the survey. But we know that social media isn't always the healthiest environment for young people, and 1 in 11 Americans have reported health issues after following TikTok advice. What's the impact here?
Yeah, that's the thing, is that because we're realizing there is a lot at stake here, that this is not a benign source of, and someone on TikTok will come on with a great deal of conviction and say, this is what you must do today, and if you're not doing this, you're putting your health at risk, and we go ahead and follow that. So I have 3 basic tips that I share with my patients when thinking about how we consume health information. It's similar to if you're a young person and you're consuming food, you ask yourself at least 3 good questions. If I'm going to pull out something from my fridge, first, is it expired? Is this old and not useful information? And then 2, is it relevant to me? There could be good food, but I don't eat baby food because baby food is not good for adults. And then 3rd, is it the kind of thing that's going to actually be relevant to my health information? So when I think about consuming health information the same way I consume food, is it credible? Am I getting this from a source or the right kind of restaurant? I'm not going to be getting food from a place that doesn't sell food typically. So the credibility, the relevance of the data, and whether or not it's up to date is really important to think about for a young person.
And with that said, there are plenty of actual doctors who do provide useful information online. Dr. Darian Sun is one of my favorites, Dr. Sanjay Gupta. But I'd like for you to make this case with our viewers as to why an in-person visit should be priority over listening to folks online.
Yeah, absolutely. And that's a case that hopefully will not be difficult for us to make, because at the end of the day, we all want personalized information. All the disclaimers that all these great doctors make on TikTok is that this is not medical advice, because I don't know if this is personally relevant to you. I don't know your personal situation. So for us to take this as a general learning point, and as we would if we're Googling information or looking on WebMD, that's a good starting point. But to take that and become actually a well-informed patient, a well-informed consumer, when I'm coming to the doctor myself, I come in with my own questions. And I say, you know what, I read this or I came across this video. I don't know if it's relevant to me. I don't know if it means that I have this. But I want to now arm myself with this and then fact check it. We trust but verify. Take that information in, but take it to an expert and say, is this relevant to me? How will this impact my own health? And allow myself to be guided by someone that I can trust ultimately with my own health.
Trust but verify is something we are very familiar with. As somebody who didn't have a PCP for years, I see this information and I think these folks actually care about their health. They're asking questions, they're engaging with community, but the way they're going about it might not be the most beneficial or most personalized, as we've been talking about. What can be done here to really curb these trends, and should there be a code of ethics of some sort put in place for influencers and platforms to follow so that people aren't misguided when they're looking for health suggestions and things of the like?
Absolutely, and this is actually the direction now where a lot of state medical boards or boards that provide certification for physicians is going in that direction. There are several cases that are being cited that if you are deliberately spreading misinformation, you will be held accountable by your state medical board, especially around the information that we had with the pandemic and so on. So if you're someone who is creating content, there is now more and more of a liability around your credibility and the disinformation that's being spread because it's having real life health impact on patients. So the more we're aware of that and the more we as a public can say, you know what, we don't want to shame people for looking on TikTok for health information, but we collectively want to hold experts accountable, that you can't say something that is not verified, you can't say something that is not relevant if you're going to be spreading health information in particular.
Really quickly, Doctor, I'm just curious, how often are you connecting with young folks about this? And what are some of the reasons they're saying that they're turning to social media as opposed to, making that appointment, whether it be for an in-person visit or telehealth?
On a daily basis, and the number one reason, there was actually a big news story in New York where the time with doctors is being slashed in half now. There's a pressure for us as doctors to spend less and less time with our patients, and young people are feeling that. If I go to a doctor and he spends 5 minutes with me, I don't have time to unpack what's going on with me, the questions I have. So the community there that's being built on TikTok is what's being promised. They say, you know what, you'll be validated, the concerns you have, there'll be other people who have that concern. So it's really important for us to understand that people are going for a good reason, as we're mentioning, and that we're not helping the cause by slashing time with patients in real life. So we can advocate for this and say the hunger is there, the curiosity is there. We want to leverage that to actually spend more time with patients to really make an impact on their health.
All right, great conversation. Dr. Mirhom, Assistant Professor of Psychiatry at Columbia University.